guest on our live line, Suzanne Gordon, author, Wounds of War co-editor, and with the Culture and Politics of Healthcare Work Senior Policy Fellow Analyst, Veteran Healthcare Policy Institute. Miss Gordon, thank you so much.
Thank you for having me, Cliff.
It's a pleasure to have you. Also, we have Jasper Craven with us, VHPI Policy Fellow covering policy issues on local, state, and federal levels that includes New York Times, Boston Globe, Chicago Tribune, and Vermont Digger. Presently, he's focused on military and veteran issues that lobby over veterans' policies. Mr. Craven, thank you so much for being with us.
Thank
you.
My
pleasure.
Appreciate it. Thank you. Suzanne, I want to ask you, you're an author, and there's some things that are going on that I want to ask you about right off with the policies and the problems that we're having right now. There's an article in the Sun-Times, I don't know whether you saw it or not, but it's today's Sun-Times. And what it says is, union says VA hospital workers able to telecommute told to come in. Now, of course, are you familiar with that at all?
I'm not. I don't know what the Sun-Times reported today. I mean,
yeah.
I'd have to know more about it because
let me read it to you, so that you know. When he announced his stay-at-home order Friday, our governor told Illinoisans, if you can work from home and aren't already doing so, now's the time that you must. Now, you know, that may sound good, but the situation is a local steward for the union representing some workers at the Jesse Brown VA Medical Center said members who could follow Pritzker's instructions are still being told to come to work. Jennifer Cushman, a local steward for the American Federation of Government Employees, Local 789, said, it's a move that could put workers and patients at risk. All the public officials, media, even our president, who is the head of the federal government for which we work, are emphasizing social distancing, end quote. Cushman said, and our hospital is not putting that into place. What's your comment on that?
Jasper, do you want to comment?
Well, I mean, it's a real tricky situation, Cliff. I mean, I'm here in New York, and Governor Cuomo has similarly ordered folks to stay home if possible, but there are a number of essential services, whether it's healthcare delivery or, grocery store attendance, where folks are expected to come in and work. The VA right now is trying to ramp up a very ambitious plan where it's simultaneously caring for 9 million veterans while also getting ready for a potential deluge of civilian patients should this coronavirus outbreak really pop off. And so from what I've read, I mean, there's been a number of hospitals where folks have been asked to come in, even though they contend they would be able to do their jobs just as well from home. And I think that it's hard to exactly tell. I think it's probably a bit of a case-by-case basis. I know that there's also some concern from the VA to have too many folks working from home because that could actually put a lot of stress on the VA's sort of internet network, and they need to keep that network fairly open so that telehealth appointments can continue effectively. And essentially what those are remote appointments where vets can check in and receive treatment virtually. So, there's obviously a million different factors here, and certainly Suzanne and I want all VA employees to be safe, and if they can work from home, they should, but that's obviously not for us to decide.
Yeah, I mean, most VAs around the country are moving to telehealth. I really don't know what is going on there, and I don't know which employees. I mean, one of the things that's happening and that will happen if this crisis gets worse is that, and this is why the VA is so uniquely poised to play a leadership role in this crisis and why it's better than a lot of other for-profit or private sector hospital systems, is that because VA employees are on salary, they can be shifted from outpatient work, which is really shutting down except for elective things. I mean, with elective things, really urgent things, they can be moved to take care of patients on the inpatient, or like if you're canceling elective surgeries in the VA, which they're doing, you can move like an orthopedic surgeon to do testing. You can't really do that in the private sector because 50% of people who work in hospitals are contractors. They're not employees, and you can't really just order them to shift to other work. So the VA, I mean, I don't know about what's going on particularly at Jesse Brown, but the VA really has a unique capacity to deal with a situation like this. And, the media needs to be focusing on that as well.
Yeah, I was sort of surprised to see the article. We have the people in here quite often from Jesse Brown, and anyway, at any rate, we don't, know. We wanted to know what you folks thought about that.
Yeah.
Yeah, exactly. What, in your opinion of both of you, do we have relative to what is going on?
Well, I mean, the VA is a coordinated system, and this lack of coordination in the broader healthcare system is really not helpful in fighting something like this. I mean, the VA can shift supplies, from place to place when needed. It can shift staff. It has a much bigger telehealth capacity than any other private sector system. And Kenneth Kaiser, who used to be the Undersecretary for Health under Clinton and is a public health physician and expert, has pointed out that one of the things missing in this whole discussion, or not given enough emphasis, is ramping up the capacity for telehealth, because you have to have a pretty sophisticated system in order to do like ear exams or dermatology exams or PT telehealth, and the VA does that already. So veterans are in a much better situation because you're not going to have to cancel as many things. I mean, they're canceling, for example, PTSD groups and mental health groups all over the country, to protect veterans and staff, but they are also sort of replacing that with one-to-one appointments. I mean, I think the thing Jasper and I are really concerned about is that, and we've talked about that on this show before, you have 49,000, 50,000 vacancies in the VA, in the Veterans Health Administration. The secretary, who's suddenly, interested in the agency as opposed to privatizing it, has said he's not interested in filling those vacancies. Now suddenly he's going to fill some when he should have been filling them all along. And, if you have a situation like this, you simply cannot afford to have that many vacancies because, as you know, Cliff, I mean, particularly with the lack of testing, which is really a tremendous failure of the Trump administration. We've known this could happen for years. One of the reasons why you want testing is if somebody's in your hospital sick and you don't know if it's coronavirus or not, you're going to send out every nurse, every doctor, every physical therapist who's come near that patient and quarantine them for 2 weeks. And it might not be necessary because the patient doesn't even have coronavirus. So you have to have, and if the patient does have coronavirus, and you're going to send people home, so you have to have a lot of extra staff. You have to have surplus, and they have a deficiency. And this is just showing the folly of the Trump administration policy of privatizing the VA, of trying to send veterans out into the private sector, which is, by the way, crumbling. And I think Jasper and I both feel that this whole situation really just underscores the folly of the VA Mission Act and the idea that you can get veterans better care by sending them out into the private sector. And perhaps Jasper would like to say something about that.
Yeah, that'd be great. Suzanne, thank you. Jasper, go right ahead.
Yeah, absolutely. I mean, I would agree with everything Suzanne said. And, unfortunately, this disaster is coming at a very bad time. The VA is seeing an unprecedented privatization push right now. This law, the VA Mission Act, which was heavily lobbied on by corporate and ideological interests, including major hospital and healthcare companies, has begun putting veterans into the private sector, and the VA so far has been very tight-lipped on what exactly this care is looking like, how much it's costing, everything else. I mean, in addition to the 50,000 or so vacancies, there's an untold amount of money that's been pushed into the private sector and has therefore really starved a lot of VA hospitals across the country. At this point, roughly 25% of all VHA, which is the Veterans Health Administration, care money is going to the private sector. That, again, is really hurting folks across the country as they try to deal with veteran care needs day to day. Now there's this huge new demon in the coronavirus they have to contend with, and folks are overworked. They're very stressed out. I mean, with these vacancies comes just a lot of really trying work for these people. I mean, we've been talking to a number of clinicians who speak about 60-hour work weeks as fairly routine. And so, this is a time where I think the VA will step up, and there's a lot the VA can offer. The VA has on hand 3,000 clinical staff that are ready to jump in and assist if and when President Trump asks them to. They have 16,000 acute care beds they can offer. They have 1,000 isolation rooms. They have 3,000 ventilators. They have command units. They have volunteers. There's a lot they can do if Trump will ask, but it's still concerning just because of the recent history of lawmakers attacking this department.
Interesting. Our call-in number is 312-374-8130. We're pleased to have Suzanne Gordon. You just heard from Jasper Craven. And how much of this is just strictly to either of you, just strictly politics, rather than trying to take care of the veterans?
Well, I think it's all politics. I mean, this whole effort to outsource patients to the private sector has been completely promoted by the billionaire Koch brothers who hate government and hate the VA. And even though the VA works really well, and a lot of hospital industry and pharmaceutical folks who want the VA pot of money. But I mean, I think now your veteran listeners should really be rethinking this ideological commitment that some of them are supporting that is really going to hurt them because, coronavirus it really, 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 I can't say enough reallys, really a danger to veterans, particularly the veterans who use the VHA, because you have to have a service-connected disability or low income to be eligible. And veterans like yourself, Cliff, particularly Vietnam veterans, all of them. I mean, young veterans and older veterans are all at risk because they have more underlying health problems. The young vets have respiratory problems that puts them at huge high risk if they've been in the recent conflicts in the Middle East, the older veterans, anything that you have as an underlying health condition puts you at huge risk for this virus. That's who's being attacked, that's who's being killed, and that is really veterans. Almost virtually the entire VHA population of 9.5 million is at risk for this virus and for serious problems. And, people should really be asking themselves questions not only about the VHA, but about government, because we have a country where people are thinking the private sector can do no bad and the government can do no good. And suddenly people are realizing, wait a minute, who's going to get them paid sick leave? Who's going to bail out their industry? Who's going to save them from bankruptcy? And also, who's going to protect their health? And I think veterans should be on the phone to the White House saying, stop bashing the media, stop bashing everybody, and start doing something constructive. And one of the most constructive things that people can do is repeal the Mission Act. This is not working. You don't want veterans to be going to the private sector. Right. The private sector is collapsing.
Well stated. Suzanne Gordon, thank you. Jasper Craven, thank you. Thank you both. You're great, giving us some great information, and we'll be talking to you again.